Hello, I'm Brianne. What's your name?
Alexis.
I am a licensed professional counselor, and so we're just going to do an assessment today to see how you're doing and where you're at. And I just want to make sure that you have things under control. I just want you to know that anything we talk about though right now that is said, it's between us. It's confidential. However, if something comes up where I see that you're a danger to yourself or to others, or if there's any child or elderly person at risk, then I have to report that. Also, if anything comes up that I'm subpoenaed to come and speak to you or to the court about you, we will consult first on what was going to be said, and then we'll go process from there. So, does that sound okay? Does that make sense?
Sure.
Do you have any questions?
Nope.
Okay, so I just want to ask you a couple questions. So feel free to answer freely. Don't hold back anything. So I just want to know what brought you in today. Like what are the stressful things that are going on in your life right now?
Well, probably know that freaking came in because I was brought in.
Okay.
I threw a freaking computer across the room at work. Kind of freaked out. So that my boss called the cops on me.
So I'm hearing as you threw a computer at work. Did you break the computer? Was anyone injured in that toss or?
No, I just broke the
And
computer.
so your employer called the police, and then they brought you here.
Yeah.
Okay. And so anything else besides that's going on right now?
Well, what's going on is that my boyfriend just freaking broke up with me, and well, it's just been a really tough week. That's all. It's I just didn't see it coming, truthfully.
I'm sorry to hear that.
Yeah. So it seems that we've been going out for a year now, practically, and he just breaks up with me out of nowhere. There's no reason for this to have happened. I don't understand. I'm completely at a loss of why. He didn't give me a reason. He didn't give me an explanation, and he's already starting to see other people. I guess this morning he started dating this new girl named Sheila. I don't even know. I just can't think that maybe he was cheating on me. Because where is this coming from? How did this happen? We just broke up.
Sorry
I don't even know what to say.
I can understand how you being frustrated and maybe upset, especially if it came out of nowhere. That sounds pretty normal. So, I just want to ask you some other questions. Has anyone in your family ever thought about suicide or ever committed suicide?
No.
No? Has anyone ever had emotional problems in your family?
I think everybody has emotional problems. Everybody, to a certain extent. So I don't know what you mean exactly, specifically by
Maybe
emotional.
depression, anxiety, anger.
I think we all kind of have a temper in my family, but that's normal.
Okay.
Some people have more temper than others.
Okay, so Alexis, I'm going to ask you right now, in all seriousness, do you have any thought of killing yourself?
Yeah, I have.
Okay, and right now on a scale from 1 to 10, where would you rate that? 10 being like, I'm ready to do this right now, and 1 being, you know what, that's not even in the picture.
Well, like a 7.
Okay, 7. And so when you say a 7, what does that mean for you?
Well, so I guess after he broke up with me, it really hurt. I'm still hurt. I'm so angry, and I just want to hurt him, and then I want to hurt myself.
So I hear that you said that you want to hurt him. Are you thinking about how would you do that?
I kind of thought, maybe I could get a gun. That I could do that.
So on a scale from 1 to 10 again, how much do you feel, 10 being like, I'm going to end his life today, and 1 being like, no, it's not a problem. Where do you rate yourself on that scale with having those feelings of wanting to hurt him?
A 9.
A 9. And do you have a plan of how you said, so you said you would kill him with a gun, right? Is that what you said? And what about yourself?
Same.
Same. Do you have access to a gun?
No,
No.
but I'm sure I could get one easily.
Does anyone in your family or the home that you're living in right now have access to a gun?
No.
Okay. Any friends?
Maybe. I haven't really ever talked about it with them, so maybe if you might.
Okay, so if you can recall any friends, as we go on that you think would have access to that, would you mind giving us their name and number so we can call them to make sure we put them in a safe place?
Sure.
So, Alexis, have you ever had any previous attempts of wanting to commit suicide, or any attempts of committing suicide before, or any thoughts of wanting to commit suicide before? No, this is the first time these feelings ever come up. Okay, and so I'm guessing with all these things that are going on in your life right now, and demonstrating that through throwing a computer and punching a hole in the wall at work, and your boyfriend breaking up with you, and seeing other people from what I'm hearing you say, what degree of emotional pain would you rate yourself at? Again, we're doing a scale of 1 to 10, 10 being like, I really cannot handle myself right now, I can't handle my life, I feel like it's out of control, and I don't have any hope, and 1 being like, you know what, it'll pass.
I would say 12.
12. And so you're just way up to here with it. Okay. And what makes that number so high?
I'm just hurting a lot. I'm just past 10. It's just, I just can't understand why he would do this to me.
Right. So if I could ask you to tell me some of the feelings that you would relate to all of this situation right now, what would you say? Are you confused, angry, hurt, mad, sad, happy? What would you say?
I'm confused, I'm angry, I'm hurt, I'm extremely mad, extremely hurt. Just so angry.
Let me ask you another question then. Have you lost, besides with the stuff with your boyfriend, have you lost anything or anyone recently and other drastic changes in your life?
I might be losing my job now.
Has this ever happened at work before?
No.
It's the first time.
Yeah, I've never acted out in public, not like to this extent.
So when you say public, you mean you've done this at home before?
Yeah, a few times.
How much do you normally damage your own property, or what does that look like?
Yeah, well, I pretty much sometimes I'll throw my stuff across the room. I get angry, or when I'm hurt or whatever, I kind of need to express it.
Do you have any history of experimentation with drugs or alcohol?
I smoke marijuana sometimes.
Okay. Well, when did you first start smoking marijuana?
High school, I think. Yeah.
So 14, 15, or 16, 17? What would you say?
Around 16, 17.
And how often do you use?
A few times a week. Sometimes once a week.
And how much do you use when you do that?
A joint or 2.
Okay. And when was the last data use that you used?
Yesterday, maybe.
Okay. And then from hearing all these different things, thank you for sharing and being honest and open with me. Just from hearing the fact, all these questions I've asked you, my last question is, do you feel like that you can make a plan for safety right now?
I don't even know if I can do that right now.
So you feel like you can't keep yourself safe?
Hopefully not.
Okay, so based on these things I hear, it's important that we keep you safe, and your boyfriend, since you said that you're having such angry feelings towards him that you want to hurt him and kill him, I'm going to recommend that we put you in inpatient just for a while, just to get you balanced out and monitored. Have you ever been diagnosed before with any mental illness or any other medical diagnoses? Okay, so we just want to continue to get you assessed and see where everything goes. And so inpatient will be a couple of days to get you balanced out. We'll do some medical management in regards to medication to see if you can be best suited for that and help you balance out and feel more of a sense of normal and a sense of balance in your life again. Also, we'll be able to work on groups, and you'll be able to process your trauma and everything that's going on with you, and learn maybe some awesome tools for anger management instead of maybe being destructive and impulsive and outlandish. And so, you know, we want the best for you. We just want to help you and make sure that you're taken care of. Is that something that you'd be interested in doing? Okay, so in this case then, if you don't feel like that's okay and you won't sign in voluntarily with our hospital that we can refer you to, we're going to have to get you emergency detained because you're not safe to yourself or to others right now. And so that will be, you're going unwillingly and you'll be there for 72 hours, and after then you'll be signed in if you choose to do so, or you can be discharged. But again, we just want the best for you and be able to help you figure out good skills to help, you know, regulate yourself well. So,
Okay.
all right, thanks so much.